Here we go. I got your head. Let me have it. There you go. There you go. There we go. It's okay. Your life when you're coming up, try to, it'll be like Family Feud, big red X. Rest of your life if you can. Roll your side. Side push up.
So when I was 14 years old, I was involved in a car accident in a passenger van, and a tire blew and we kind of rolled and landed, the car landed on the roof, the van landed on the roof. And I wasn't belted at the time, so I was definitely moving around quite a bit, but miraculously no one was seriously injured. Everybody just walked away. But it was about 2 or 3 months after that, I was getting ready for school in the morning, and I bent over the sink to wash my face, and I just had this searing pain go all down my spine. And so that really was kind of the beginning of the last 25 years of dealing with spinal pain and issues.
What treatment did you seek at that point? Did you ever tell your parents and they took you somewhere?
Oh yeah, I was in such great pain, just agony. So after a few hours, they were able to help me off the floor and take me to see a chiropractor. So I've seen a chiropractor on and off since then.
And how has that progressed? Is it as bad as it sometimes it was when you were 14, or has it gotten worse over time? Or
it's definitely gotten worse, and leading up to just a couple of years ago, I did seek out a spinal epidural for a disc injury. That was in L5S1
in your lower back.
In my lower back, and that really took me. I mean, I was pretty much at a 9-level pain, I would say, on a daily basis, to now probably more a 6.
That's just the lower back, but the neck is intermittent. You said at nighttime sometimes you turn the wrong way.
Yeah, the neck seems to be something that has just gotten bad since the spinal epidural.
Okay.
I mean, it has never been great since the car accident, but really more my chief complaint than the lower back now. So I found a lump in my breast on self-examination. So big advocate of doing that.
Yep.
Because at my age, we weren't screening for breast cancer, of course.
Right.
But it did turn out to be breast cancer, and I had a bilateral mastectomy with latissimus flap reconstruction, which means that they took the tissue from my back muscles to help with the reconstruction. I noticed right away after surgery and radiation that I had more limited range of motion in that right shoulder, but
have you had any treatment? Anybody done any soft tissue work? Nothing?
No.
Okay.
I mean, I've had just regular deep tissue massage, that kind of thing.
Okay.
More for relaxation than therapy.
No gua sha, no. Okay. No elbow. All right. Migraines. How frequent do you have headaches? Or
well, I take medication to help me with that, so really that controls them. But if I didn't have medication, it would be weekly.
Okay. Left shoulder's elevated, and like we said earlier, your neck likes to tilt to the right. Sorry, to your left. The head is tilted to the left. It's in avoidance. Your body is. This is the arm that mainly. You said the whole right side is sort of more symptomatic.
Yeah.
And so your body's going to want to lean away from it. And like we said earlier, even in avoiding, it still hurts. So it tells me that the problem has grown to a point where even when you're trying to get away from it, it becomes unavoidable. So the arm and your lower neck are the same thing. The health of your arm comes from the tissue and the nerves in your lower neck. So if the nerves in your lower neck are aggravated, they're going to go down your arm. At 14 years old, it would be highly unlikely that it's a disc injury at 14. It's very likely, again, without MRI, we're all just positing here. It's likely what happened when you had the car accident is that the joints in your neck got whiplash. The joints got inflamed, and then the nerves start getting irritated. The posture then starts to shift. So you have a trauma, and your body heals in avoidance. Now, by healing in avoidance, now there's parts of your neck that have aged at a faster rate because the alignment wasn't correct. Does that make sense? Like if you hit a curb with your tire on your car, you now have the damage of the curb damaging the rim, but now you have a bad alignment that then if you keep driving with that bad alignment, you'll have tire wear. So from what the postural things that I'm seeing, like I said, you're favoring, you get off that right side.
Definitely.
You want to get off the right side of your spine. Now you'll have compensatory pains over here potentially, and these are just growing on the right side. I know you said you didn't have your MRI, but the good news that why I like to see MRIs with you is I want to show you that there actually are healthier parts of your spine, that it's not all's lost, that there's still young areas that aren't accessing, that makes sense, and you'll feel overwhelmed because, Ed, like you said earlier, I can't just turn my neck. I feel like it's just going to end any moment. And that's because over time, your lower neck, which is injured, is the only part that knows how to work. The other parts around it have gotten tight or protected. They've been injured in the past, and then they quit on you. And they're actually young, but you don't bend there. It's like if you had 10 cars in your garage and you only drove 2 of them all the time, and 8 of them are all brand new with 0 miles on them,
right.
but you only have the keys for these 2 that are leaking oil and flat tires. And I'm going, how about we find the keys to these other cars and learn how to drive those guys and just put those 2 that are injured away. That's the best way I can describe how I'm going to help your back. There have to be, and that's what the MRI would help me show you, is look how young your upper neck is. Well, Ed, it doesn't feel young. I understand, but because you don't know how to bend there.
Right.
And that's what chiropractic can do for you is what we're going to, I expect Ed, it does not feel good for my upper neck to be rubbed. And that needs to be worked through. So we go through, get the parts of your back that are stuck working. The areas that are injured, again, some tissue can't repair. The discs are not replaceable.
Right.
So this is where we have to, like a cracked tooth, just not chew on them so much. But like I said, we're going to go through and get the other parts of your neck working. And then I mentioned earlier, have you heard the word lordosis, which is the arch? The arch in your neck is important and imperative for it to be there for the weight of your spine to be evenly spread. When your neck curve goes straight like a ladder, all the weight goes to the bottom, and that continually aggravates your lower neck. And that's why I'm seeing your head go forward. Your body's trying to go into avoidance, and that will, if left alone,
right.
keep growing. And then you said you broke your...
Yeah, I broke my femur when I was 3. Apparently I'm a little bit accident prone. Just playing on my swing set in my backyard.
Let me see. And it wasn't at the growth plate? Did they say it was at the growth plate?
I don't remember, but I was in traction for a long time. Like, it happened on Halloween, and we had Christmas decorations up when I came home from the hospital. So my femur hurt like for years after the break. I mean, recently I haven't noticed it, but it used to be like anytime it would rain, I could tell weather was coming because it would hurt in my right femur.
I don't see any difference in terms of the length of your femur. The femoral, everything is just higher on your left side. So the left femoral head's higher, this left hip is higher. Your body's trying to get away from your right side. So when you lift your left hip up, the holes that the nerves pass through on the right get larger. It's just a way of making. We have disc injury. You already told me I have disc injury. So obviously with disc injury comes compensation movements. Your body's going to try to adjust and fidget and move things around. So I want to work on. We're not going to directly undo that hip height. Your body. How about this? As we get the pressure off your lower back to your middle back, the lower back won't be aggravated so much. The hip will come back down because it doesn't need to be elevated. The body purposefully and intelligently raises that hip to get relief. Take a deep breath in, and then let your air go out. Exhale, let it all go. All right, deep breath in, it's okay. Here we go. Exhale, let it all go. Here we go. You all right? Here we go. All right, that was tough. All right, deep breath in. Here we go. One more. It's okay. Exhale, let it go. Exhale. All right, yeah, we got work to do. It's okay, you all right?
Yeah, I'm good.
Down your belly. All right, breathe in deep. Just breathe and stretch. Nobody should adjust your lower back. We're going to leave the lower back alone. We're going to loosen up your middle back a little bit, and I'm going to just see if we can get the SI joint moving a little bit. All right, breathe. Exhale. There we go. Exhale. All right, breathe. Here we go. Exhale. There we go. It's okay. Other side for me. It's okay. Other side. I'm assessing and placement testing you right now, seeing how much of your back works. There is a lot of benefit to loosening the SI joint, but not at the expense of aggravating your lower back. So we might try to loosen up this joint a little bit so it can be easily adjusted, but I want to see, this is really tight, and that's why your lower back is upset. All right, arch, hands on your belly. There we go. Breathe. Exhale. Okay, breathe. Exhale. It's okay. Face up for me. Face up. We'll do it again. Yeah, everything's to the right over here. Here we go. I got your head. Let me have it. There you go. There you go. There we go. It's okay. So, here we go. Just chin up. There we go. Okay. Very good. Ed, I think if you adjusted me harder, more bones can move. I know. I'm not gonna. We're prepping. That's the.
I'm good.
Okay.
That was
You're
good.
doing great. We're just trying to loosen the upper neck. There you go. Turn it left. There we go. I got you. That's why we use the word adjustment. It's a purposeful thing that we use the word adjustment because we're trying to adjust certain areas and not adjust other areas. 60% of the work of your neck is designed to happen at the atlas, and if the upper neck is not functioning properly, your lower neck will compensate and do the work that your upper neck is doing or is supposed to be doing. You'll also recruit your upper thoracic, so your upper back will be utilized in neck rotation. That's partly why when I did that hug adjustment earlier, your upper back pretty much didn't want to move at all. We moved in the middle and then middle lower area, but the upper back is completely jammed, and that's because you got it doing a job it wasn't designed to do, which is turn your neck.
Right.
Larry King was my poster child for, late night guy. Whenever he was,
yeah.
he would just, it was all you see his shoulders turn. There was no neck
Right.
rotation when he turned. It was like, anyway, gotta get those suspenders. Anyway, no, don't make fun of Larry King, Ed. Right there.
Mm-hmm.
It's like the opposite question I ask. I ask, why is it not injured in all these other areas? And I don't feel like that question is even posited. We're just focusing completely cortisone shots and trying to do things to the damaged areas. And if you don't see all the uninjured areas as the cause, then you'll never fix it. You'll never get to it. You have to help chiropractors or people in your area stop focusing on it's disc herniated, and what are you going to do about it? Stop. I think of Morgan Freeman. Stop talking about it. Just stop
Right.
looking at it. Stop talking about it. Leave it alone. Oh wow.
I feel like that side actually feels more tender.
More tender, yeah.
Mhm.
Yeah, right there. It's a nice little. All right. Epsom salt on your upper neck. So when this evening, if you have the ability, get some Epsom salt.
Okay.
Take a cup of water, pour some Epsom salt in the cup, let the salt dissolve a little bit, scoop some of the salt out, rub it into your upper neck here, okay?
Okay.
Take a damp hand towel or paper towel and then cover the salt with a damp towel.
Okay.
And hold that on your skin for about 15 minutes. There is fluid and stiffness and congestion up here that needs to be drawn out. So osmosis through salt will draw out the fluid. It'll de-inflame the tissue by salt. Causes a sweating event, and so your body loses water. You dehydrate the tissue
Right.
by putting salt on your skin. With the water that you're moving through your skin, you're going to take the soreness out, the inflammation, the lactic acid, the pain, and we need to. It's like I can't even. These joints don't
Yeah.
move properly because they're filled with fluid. A strong feeling. This is where it's going to get dark. Right there, yeah, like you said, this is. That's what you're feeling. Right there is that inflammation that
Yeah.
you're talking about. Right there is what. And this is what causes the migraines.
Really?
Yes, ma'am. So we call it the suboccipital area here. So essentially you get a referral pain from inflammation of your upper neck, irritates the nerves that form the tract that goes to your nerve to your face, called the trigeminal thalamic tract. But essentially, this causes an overlap pain.
Interesting.
Right there,
Yeah.
you gotta have. And this is what I want you to have the Epsom salt on when your husband sees your neck in a second.
Okay.
When you look at the neck, oh my gosh, what happened to you? Right side's the same thing. Just this is. All right. Just top guy a little bit deeper. Let me hold this side. I got your chin up. All right, one more second. I got your head. It's okay. There you go. You all right? Yeah, just. Gotta be easy. When I start with like a 2 out of 10, doesn't move. Okay, let's go to 4. You're saying I just turn the dial up a little bit.
Right.
Let's go a little faster. It shouldn't ever require a He-Man adjustment, and that's about like if it didn't move in that second one, I would have just said we have to do it again later at the end of the visit because that should be plenty of force to make the bone move. It shouldn't require. It's ridiculous. The joint should be that butter, that smooth up there. It shouldn't ever be so restricted. And then what happens is if you go harder, the likelihood of aggravating the lower neck goes up because some of the force is going to go into unintended areas The only way for this to be gone permanently is stretching the curve. So in a minute, we're at the end of your visit, I'm going to show you how we're going to hold your neck. And before you go to bed at night, we're going to be stretching. And then once you're able to stretch, keep doing your stretches, call me if you have problems, and by the end of the visit, you should know what it feels like. And then what can happen is, it's been 3 months since my adjustment. I don't think the next stretch, it doesn't feel like it did before.
Mm-hmm.
And that's when it's like, well, you got to get adjusted again. Things are getting tight again. And then you're just going to be aggravating where you typically have been injured.
Right.
And this is where it's like we buy a car, your teeth, and I have to keep washing my car. I have to keep cleaning my teeth. Yeah, there is a level of that. If that frustrates people, it's like, well, then yes, you have to get adjusted to some degree. It doesn't need to be 3 times a week the rest of your life, but the goal is somewhere, let's get people feeling better, get your posture fixed, and then we get on to, I would not call this a maintenance visit. This is a corrective visit until we can get to, I can do the dental roll easily, and then we start what we call maintenance program.
Mm-hmm.
All right. Okay. Just this guy right here. I got you. There it is. Okay?
Yep.
All right, you did great.
Yeah, definitely like you're rolling over it.
Feel this. This is all
Yeah.
This is all lymphatic blockage in here. This has all been. It's not a coincidence that this was all in here. I feel all these little pieces of granules in here. None of this is how the tissue should feel, and.
Yeah, I'm aware of that.
All right. Yeah, we got to work on this. And the alignment of your shoulder. So the more forward your shoulder goes, the more likely this area becomes constricted, blocked up. Things can't drain properly. That makes sense.
Mm-hmm.
So we're gonna a little bit while we're stretching your back in a minute to fix your lower back. I'm gonna show you. Your arms are going to be at different angles, stretching your shoulders back at the same time that we're helping your middle back and trying to draw the shoulder back. All right. All right. Yeah, this is.
Yeah.
How does it feel on the other side? Does it feel like? Doesn't feel like that?
No.
Yeah.
Mm-hmm.
I'm just going to check this one to see what the difference is.
I mean, you might surprise me. You might find something there that I didn't know was a problem, but I don't think so.
Yeah. A little bit, but yeah, it's not nearly. But you said they did a double?
Yeah.
What was just preventatively they did the other?
Mm-hmm.
I gotcha.
Did they say genetics they thought maybe was what it
No,
was,
I'm
or-
BRCA negative, so
Okay.
I don't know. I mean, there of course could be other genes that we haven't identified, but my mother did have breast cancer also, so I think there's a familial connection.
Yeah.
That doesn't feel good right here. This is all really. You're good. Just trying to get some blood flowing here a little bit.
Yeah, I appreciate it so much. Thank you.
You're doing good. You're doing good. I'm just gonna. Okay. Right there. Yeah.
I definitely have like diminished sensation in that area.
Sure.
I can kind of feel like what you're feeling, but
But it doesn't feel
not like at the front.
above.
Yeah.
So right here.
Mm-hmm.
Wow. Yeah. It's usually life and probably your injuries had enough of a tightness in here, and then add on top of it surgery and now it's been 10 years post, so now your poor lower back's just saying it's had enough.
It's been a challenge.
Yeah, right there. There you go.
Yeah, definitely feel another spot there.
This upper rib needs to go down. This is what we call thoracic outlet syndrome. So 3 components of thoracic outlet. The bone in your neck needs to go in, the rib in your upper back needs to go down, and all of the tissue that the nerves sit in needs to be cleaned, meaning that the channel here doesn't have any soreness, bruising, lactic acid. Ed, you can press as hard as you like and everything feels great.
Yeah, I'm a long way from
Right,
that.
long way. Okay, all right. Well, we start this process. Yeah, right there. That's all gotta become easy. Okay. Everything's in guard mode around here. and the middle back said, "I quit," and the lower back's just left holding the tab. It's like this that Geico commercial with the alligator sitting at the table, right? If you have alligator arms, you have trouble reaching for the check, right? So the middle back's like the alligator, doesn't, almost there, maybe I'll work today,
Not
so you're
helping.
right. Your middle back isn't helping. It doesn't ever pay the tab. It just always just smooches off the lower back, and the lower back's just like, do I ever get a break? Just taking the lower back from working a 20-hour shift to like a 10-hour shift, your lower back's gonna love it. It's gonna say, "Oh, I only have to work 10 hours a day? Oh, that's wonderful. I'll have dinner tonight." Wow, it's all crunchy right there. Yeah. So in an anatomy textbook, it doesn't say crunchy area. It doesn't say that. It's just tissue, and actin, myosin are the mechanical parts of the muscle. They're supposed to be organized and like railroad tracks. They shouldn't be tangled or disorganized, and that's what it feels like in there. It feels like it's been torn, and then it healed in a knot, and then it tore again, and it healed in a knot. Yeah, it's not good right there. When you work on enough backs, you get a pretty good idea of what it should feel like, right? You get a pretty good idea of what it's like. If you detail cars for a living, you know what the paint should look like. It's like it's supposed to be smooth, actually. That's why we clay bar to get the dirt out of the paint. It's when you run your hand over paint, it's actually supposed to be butter. It shouldn't. You can wash a car and have as washed as you can, then you run your hand, it feels like a little sand. It's not supposed to be that way. Car didn't come from the factory that way. It's trees and dirt, and so this is all like trees and dirt and sap and.
Yeah, definitely not supposed to feel
Right.
that way.
Not supposed to feel all crunchy and. Not your fault. It was guarding your body. Like I said, if you had another accident and the guarding's there, it would protect you, right? You understand? The issue is convincing your body that it's not going to happen again, right? It's your body doesn't believe that. It says, "Wow, you caught me by surprise, and so from now on, I'm going to live in a manner that expects another trauma of that severity," which is good if you do, but if you don't, it's actually detrimental because now things don't flow properly. Coming up pretty quick. This is all.
No surprise, right?
Yeah, it's just going pretty smooth, right? It's not like I'm
No.
digging on you. It's coming up pretty quickly. Okay. Right where the scar is, this is where the most lactic acid is trapped because of, it doesn't circulate well. The lymphatics don't circulate well. When they open up the body, the lymphatics are this sewer pipes right underneath the skin. They get damaged. They can regrow, but you have to stimulate it. The lymphatics are like roots of a tree or a bush. It makes sense. If you create water, the roots will go towards it. You understand? If you create the demand, they can regrow and develop, but not if it's all stiff and congested and blocked up. It won't. There's no demand. The body won't fill anything. It won't regrow these. So we create the demand, and then your body will fill it. So if we bring in the materials, unpinch the nerves, that makes sense. Your body will regenerate tissue. With the discs, the more accurate terminology is rehydrating them. They can be rehydrated. They can be de-inflamed, let's call it, but they don't repair. The cartilage is a non-replaceable substance. It's a lot coming out over here. Okay. The nerves have to reside in here, and so if the tissue is acidic, it sensitizes the nerve, making the nerve easily aggravatable, right? So now you turn your neck even just slightly, does that make sense? And the nerve gets set off. So as the tissue becomes less bruised, sore, it takes more stress to bring that nerve to the excitatory point, to the firing point. Okay. The mobility of your joints, the contraction, relaxation of muscles is what flushes us out of here naturally.
Mhm.
When we have injuries, your body goes into that protective tightness, and that's what congestion. The joints are all jammed and tight because of trauma, and that's what allows the tissue to get more and more bruised. I can see why it now wasn't
Right
moving.
there.
Yes, ma'am. Yep. So the tightness in the glute is from the nerve in your lower back being upset. The nerve in your back lower back being upset causes this muscle to contract. The tight muscle in the glute now causes more inflammation, which then causes this SI joint to be stiffer, which then puts more pressure on your lower back, which then makes the nerve get aggravated, and it creates this positive feedback loop where we don't get out of it. It just keeps getting tighter and tighter. SI joint gets stiffer. The more mechanical stress goes on your L5. We have to unlock this joint right there.
Mhm.
No. Exhale. All right, it's okay. Other side for me. It's okay. It's just fluid. It's just fluid. Phil, we gotta stretch. There you go. Other side. I got it. Other side. A little gentle. It's almost there. Real gentle. See if we can get. How'd that feel? Is it okay? Okay. All right. Real gentle on it. There we go. Good. Hands to your belly. We're getting it. Almost there. Exhale. Exhale. There we go. A little bit. All right. You all right? You did great. You did great. Not the piggy. No. Okay. You okay? Yeah, you
That was a good one.
That's the one you've injured, huh? This is the one we busted?
Yes.
Yeah. Yeah, yeah. All right, let me see the rest of you. All right, there we go. Okay, good. All right.
The ankle falls loose.
Well, every step you take, pain right here, or just intermittently?
Intermittently.
Mm-hmm.
Like I said, I walk several miles most days, so sometimes it gets aggravated, but
You know, I would attribute a lot of even this to your lower back. The lower back being aggravated is going to give you symptoms here. If it is an actual ankle problem, it would be because there's not enough weight on your heel. When we're walking, sometimes we can walk with our head forward. That puts more stress on our toes. We're supposed to be upright with our weight on our heels. If you're walking with too much weight on your toes, this area is under mechanical stress. But with what I know about your lower back, I'm kind of in between. I'm going, it's probably more lower back aggravated, which causes symptoms in the area that the nerves go to. So as we get your lower back healthier, I'd want to get that fixed and then see how much of this still exists after getting the back in a better place.
yeah.
Okay?
So the right knee has recently started bothering me too. Like, do you think that also is related to the lower back?
In here?
Mm-hmm.
Right here?
Well, I feel like it's more like directly at the bottom of the patella.
Here?
Yeah, like the 6 o'clock position.
Right in here.
Mm-hmm.
So this is more tendon. I don't.
Okay.
The meniscus is usually going to be right in here, more medial.
Yeah, no, that feels maybe a little tender.
A little bit. Go ahead and stand up for me, or stand up. So go ahead and stand up for me when you're ready. Try to sit your bottom down on your heel. How difficult is that?
Not difficult.
Okay, take your foot and then like this with your toes pointed. So turn this way.
Okay.
And then put your toes pointed. Now watch me first. You're going to come down inside of the heel.
Okay.
How difficult?
I can do it. It just cracked, but
Does that cause any pain?
A little bit, yeah, and it is more in like that meniscus, like the inside.
Compare that with the other foot. So take your other leg and put it on there and do the same thing. Compare the sensation of that to this side.
Yeah, this is not
Okay.
painful at all.
All right, so there's definitely some meniscus injury in there, and the best way to rehabilitate that, it's very similar to the discs in your spine, is to rehydrate them with what I just showed you. There's 3 steps. The first is the foot's over the edge. You get your bottom down if that's too easy. Second step is your toes pointing on a bed or a couch. You come down sitting inside of the heel. The last step is you come down inside of the heel and then you put your bottom onto the heel and you hold. So you come up, down, over,
Yeah.
up. And you want to be able to eventually, even in yoga, they would, they do both. You'd be,
Mm-hmm.
and then coming back onto your, that makes sense?
Mm-hmm. Sure.
That's the position we want to get to. It's just rehydrating it. Any injury in there has to be just opened up, get blood flow in there to rehydrate it.
Okay.
Really easy. Here we go. It's okay. Here we go. Yeah, really gentle. There we go. Tilt your head left a bit for me.
I'll pop.
There you go. All right, go ahead. Tilt your head to the right a little bit for me. There you go. Tilt your head to the right.
Good. Glad we did that.
You've been baptized. So the goal is to mold the neck into this position. It takes about 20 minutes to change the ligaments that envelop and wrap the spine. 20 minutes is not a made-up number, it's a real number to change your posture. So we have to make the spine soft, and then we cast it into the right position. It would be unfortunate if we make your spine soft and then we go sit in a lazy boy chair,
Sure.
right? Because now you're hardening your body in the wrong position. So you just had some great treatment, but then you spent the next 2 hours rounding forward, so now you've gotten stiffer. Does that make sense?
Yeah.
So the treatment should almost always be followed up with some as your body cools down, it hardens in the right position. So right after the treatment, I want people laying down and stretching and arching back so we can start showing you the way we want your body to be in for the longest period of time, which is curving your neck, curving your lower back.
Right.
So you get rid of the things that need to be avoided, you train the body to be in the right position, and then you'll just want to be there, not you having to constantly, consciously think about holding yourself in the right position. I find that to be silly. It's
Right.
To me, it's strengthen your rhomboids, and that'll hold you upright. I don't. If anything, it just further aggravates your lower neck. Because any strengthening exercises, you end up just further aggravating the loose parts of your spine, right? So I don't subscribe to a strengthening regime as much as it sounds like a good thing. Like, oh yeah, strengthen your rhomboids, that'll hold your body upright, which is the right posture. But then your muscles get tired,
Right.
and you just fatigue right back into the wrong alignment. I don't know how we can depend on muscles to be the thing. What you need is the rubber bands on the front, anterior longitudinal ligaments, the ligaments on the front that have never been stretched. These are all tight, and the ligaments on the back have all been stretched and they're all loose. Does that make sense? So now your body wants to stay here because this is so tight. So how do you make your body want to be upright? You got to go so deep bending back to stretch the front. Does that make sense? So now when I'm upright, this ligament's not so tight, does just pull me back forward again.
Right.
We can't bend you back enough to effectively stretch this ligament if there's all that inflammation in your back. Ed, you're hurting me. There's too much pain, I can't do it. So we have to spend 8 visits sometime, or 6, 8, I don't know how, to get your spine soft enough and not so sore enough to go deep enough to get your body just want to be upright. And then when your body's upright, with the ear of the shoulder and the curves in your neck, there's not going to be pressure points. There's not going to be parts of your spine that are overworking, which then cause pain, headaches, and whole gamut. You okay?
Yeah.
Any
Okay.
questions or?
No.
All right. How did that feel after is it pretty sore and everything? Any feedback?
I just feel warm and relaxed. So
Excellent.
Yeah, it's good.
There you go. Arms up. All right. So your husband can see these yoga blocks I have behind your head. This is to reduce the depth. We don't need to go for the kill the first time you do this, okay? I expect this to be a story of progression, like orthodontistry. It's going to take time so the goal is to not overwhelm you. We need to start somewhere, okay? So make the stretch easy. Do 20 minutes. Then go a little bit deeper. Too painful? Back off a little bit. Does that make sense? If the hand,
So it's like my arms that are the problem.
Put them aside.
Okay.
Put them aside. It's going to be time. So you have plenty of work to do laterally. But yes, you want to work all these angles, and you need somebody to work on that shoulder. That makes sense. Stretch all this out so you can do this. If it's too difficult, put your hands in your belly. Your life when you're coming up, try to be like Family Feud, big red X. Rest of your life if you can. Roll your side push up. Does that make sense? It's just easier on your lower back, especially when we have a disc injury.
It's cool than doing
I know. Got your upper neck working. This is like step 1 today. We got the upper neck working. I want you, at least let me know how the neck down roll is doing. If it just hurts where it's pressing up here, it's okay.
Mhm.
All right. Back of the neck goes tingly, those are okay. If you notice something's going worse in the arm while you're on it, stop. If it's worse afterward in your arm, afterwards when you get off, call me.
Okay.
You know, it's a little bit of trial and error. I have to run a test and see how the results are, and then based on that
Right,
information, I go, okay, you need 2 more visits before it's. The neck down roll should be a joke. It should be you're on it for 20 minutes and it just feels
Right,
great.
right.
You understand? One,
Mhm.
that's the normal. That's what it should be like. But I expect with Ed, I can barely turn my neck and things are upset. We're going to be running into some things back there. Don't be disheartened. It is a process, and I'll be here for you as much as I can. And just call me, okay? And
Okay.
all right, you okay?
Thank you.
All
Yeah,
right, okay.
I'm
You
good.
did
Yeah,
great.
thank you so
All right.
much. I
Thank you.
appreciate it. Appreciate
Thanks for
you.
the time.
Thank you.